Rickets is a softening and a weakening of bones in children, typically due to inadequate vitamin D, calcium, or phosphate. It is deficient mineralization at the growth plates before the fusion of epiphyses. So it is a disease of a growing bone. It's a disease of a child. It is most common in infants aged 6 to 24 months during a rapid growth period. Let us see clinical signs of rickets in children, which is a comprehensive head-to-toe clinical examination. To start from head and the neck, the first sign is, or the most common initial sign of rickets is craniotapes, which is softening of the skull bones. They may feel like a ping-pong ball when pressed. The other is delayed fontanel closure. The soft spot on the top of the head remains open past the typical 80 to 24 months mark. The other sign of rickets on head is frontal bossing, which is unusually prominent and a protruding forehead. The other is caput quadratum, which is a square-headed appearance due to thickening of the skull. The other is dental manifestations. From this, the first is delayed eruption, late appearance of primary or baby teeth. Delayed eruption is defined as notice at the age of 13 months. The other is enamel defect, weak tooth enamel, pitting or holes, and increased caries, higher susceptibility to cavities and dental infections. Chest and spine signs. The first is rachitic rosary, visible or palpable bead-like bumps at the costochondral junction, where ribs meet cartilage. Addison's groove is a horizontal depression along the lower border of the chest caused by the diaphragm pulling on the weakened ribs. The other is pigeon chest or pectus carinatum. The breastbone or sternum projects forward. Spinal deformities such as abnormal curvature including scoliosis, lateral kyphosis, or lordosis. The next is upper and lower extremities. Widened wrists and ankles are swelling at the ends of long bones where growth plates are located. Both legs or gena varum is outward curving of the legs, common when a child starts walking. Knock knees or gena valgum is inward curving of the knees, often seen in older children. One dyspeptic deformity is when one leg shows valgus or nycno, while the other shows varus or bowing. Other signs of rickets is seen on pelvic and general skeletal signs. From this, pelvic deformity is one of them, which is contraction or misshaping of the pelvic outlet, which can cause complication later in life. Green stick fracture, which is subtle bending fractures of soft bones under minor stress. And stunted growth, overall short stature and failure to reach height milestone. Neuromuscular and systemic signs include hypotonia, which is floppy baby syndrome or low muscle tone. Other is waddling gait, a characteristic walking style due to pelvic instability and muscle weakness. In severe cases, low calcium can lead to tetany, muscle spasm or fits, which is called hypocalcemic seizures. General grumpiness or listlessness due to bone pain or irritability is seen. Those are head to toe manifestation of rickets. Thank you for watching.